Well, again, Laura, thank you very much for helping open us up this evening. And again, my name is Garth Reynolds. I'm your executive director for the IPHA side and a board member and officer in charge of the IPME Corporation. And we're going to be taking us through, as Laura said, some of recapping some of the components from another the other night. Let's see here.
We're
We
trying
do
to,
have some.
yeah,
We
we're
do,
trying to clean up some note taking by AI.
yeah. Sorry, we don't allow that in these calls. So, just as a reminder of our IPHA antitrust cautionary statement that, again, we're a voluntary organization and this includes all of our subsidiaries, which would include IPME, that we are a voluntary association comprised of licensed pharmacists who practice in various settings. And consequently, these members of IPHA deemed to be in competition with each other for purposes of state and federal antitrust law, and IPHA will not condone any activities which are viewed to be a violation of the antitrust laws. And the remaining of the language I will leave for you to peruse at your leisure. We're also, because we're an affiliate of CPSN USA, we also have to adhere to their antitrust statements, which we reviewed at the last meeting, but I put here again for your viewing pleasure as well. So tonight's agenda, we're going to be reviewing some of the quality assurance standards from USA, the USA Network regarding retail and community-based MPIs, discussing the naloxone standing order and the opioid stewardship plan, review of the types of services that are within our scope of practices under the Illinois Pharmacy Practice Act, talk about DPP coaches and the opportunities for not just only pharmacists, but also pharmacy technicians. And then, as stated earlier, just to get some time for more of your questions. And then we'll end up with our meeting date. And we're shifting our meetings a little bit. We discussed in January trying to look at the third Tuesday, and we realized that we are in conflict with actually a very important regular scheduled meeting with CPSN USA for our leadership side. So that's one of the reasons why you don't see Lauren Yildiz on the call tonight. She's attending that call. So we do need to shift to the fourth Tuesday. So as we go forward, we'll be going back to that fourth Tuesday of the month. So I am going to turn it over to Starlin over these next couple slides and opportunities where we need some additional information and we need some participation in some other areas, and we need your help. So I'll turn it over to Starlin.
Good evening. This is going to be a repeat from last month, but in order to be part of a network that is recommended for a commercial insurer or Medicare or Medicaid, we have to have a quality assurance standard. And we are part of CPSN network, USA network, and their quality standards are basically broken down into these three areas. And thank you for those who have already filled out the 15-minute CPSN pharmacy self-assessment. This is the link to it. You'll get a copy of the slides that you can click to it. You also get a copy. You should be getting Sunday night emails from Jay that kind of bring up what they're wanting all of us to pay attention to, and those links are in there as well. So this self-assessment is long and detailed and necessary because it allows us to see, oh, you have a software system that doesn't let you send e-care plans. So we can create an alternative quality assurance standard for you to do until we get you hooked up until your software lets you do e-care plans. The easiest one for Illinois pharmacists to do is the opioid stewardship plan, and they already have a template you don't have to write it. They have a template in place. You just have to change the name on it, and then you fill out the citation link. And next slide, please. Oh, so he has me running. Okay. All right. So this is more in depth to show you the timeline, where the timeline is by March 31st, we should try to get some of all of this done. In the opioid steward plan, there's a learning system that gives you an overview of it. There you go into you get the training. They have 3 modules, and this doesn't have to be the charge pharmacist. It can be, you can assign a pharmacy student or a super tech or a tech or to someone to read this and help you get all the paperwork together so that we can implement this. So if you don't have time as a pharmacist, you can find a pharmacy clerk or a great student that comes every weekend and works in your store, like I used to do. Anyway, so you log in and it gives you the education stewardship plan, and then it has this little 25-minute educational training, and then module 3, and it keeps track of all that so you get credit for doing it. The self-assessment again it gives us details about your pharmacy and what you are able to provide as a service, so that we can see where the gaps are and see where the pearls are, the good practices. So if there's some good practices and we want to try to all create a subgroup and get a like a test and treat cash program together, then you tell us that on this form, and that allows us to put that together. And then there's also a list of the quality-based metrics, which is part of my job of helping you. I have to attest, they said by the 21st, but they moved that to the 26th. If I don't know that you're doing it, and I am getting lists, they keep track of all this, and then from the mothership brings it down and gives us a list of what's going on. And most of you are doing some of these things. We're not all doing all of them, but the effort to try to get to that is what we're trying to do, which is why the opioid stewardship plan kind of goes along with our state scope of practice rule on naloxone, and about talking to patients about the opioid adverse reactions and the propensity to become addicted to that. And so that is basically the opioid stewardship plan. Next slide. This is the whole list of all the quality metrics, so that we're trying to get one in each measure, 1, 2, and if you can't do the e-care plans, but you're in let's say you're transforming your pharmacy into a new software system to do e-care plans, that counts as a metric. That's like an example of an effort to move that way. Next slide. This again goes over the core strategies, and I'm just trying to be as very explicit and as I can be. Next slide. So this is what you can implement, and then here's the guide that helps us process all this. And then the next slide. And then this is all contained on its own website called the Opioid Stewardship Plan. And you can click through there and get copies of all this, and it takes you to the training, takes you to the implementation guide and the template, so that you can use that in your own pharmacies. Next slide. So we want to review the naloxone standing order opioid stewardship plan, because in Illinois, it is our fiduciary responsibility to provide this. And if you get a prescription, and which the physicians also are have to abide by our opioid stewardship plan for the state of Illinois, then you can bill for providing the naloxone. And we have several pharmacists who have been very it's been very profitable for them to, they've even increased the amount that they are giving us, reimbursing us for it, and for the dispensing fee. So again, part of what our goals are is not to give you something that we can't attach it to some sort of reimbursement somewhere along the way that we can develop. Because if we're just doing it for the process of doing it, not getting reimbursed, we don't want to do that, because then we're giving away uncompensated care. So the naloxone dispensing goes really well with our opioid steward plan, and then we all get kudos from the grand poobah by being a quality, improving quality within Illinois and within our network. Next slide. This is the copy of our opioid overdose reversal agent standardized procedure. And if you'll get these slides, but we can also give you a copy of this. Is there anything you want to point out on this, Garth?
Yeah. So this was just renewed actually a couple weeks ago. And that's one thing going through the next couple of slides, just to kind of remind everyone of, you know, that's one great thing about this being a good crossover plan here, and a great way of taking your first steps into working both on with the USA program and, you know, some of the Illinois initiatives that, you know, we have worked with the state to help develop. And it's a good, easy way of trying to step yourself into this process of filling out e-care plans, filling out some of the quality initiative paperwork for USA. And most of you have already completed the statewide standing order paperwork for the state of Illinois. If you have not, you can go ahead and rescan here. You attest to, and they have a link to a couple of the short training programs. Originally, you know, IPHA used to have one a little while back, and we may revive that program to some extent. But they have some qualified programs that will help you with going through the training that you need, which is very basic. I mean, most of us have worked with naloxone at some point now. So it's a lot different than when we first started the program in 2017. So you'll fill this out. This will get you attached to the statewide standing order. That information is passed over to the prescription monitoring program, who help monitors which pharmacists are on the statewide standing order. You'll get a copy of what you saw on the previous slide, which will at the end of it have the information for the physician who's actually the director of public health right now, with his MPI number and information that you need for billing. As Starlin already alluded to, we do have some responsibilities, and this is where, again, this is a great natural first step to get into this program, and you're meeting quality measurement standards for the USA network, which helps us with meeting our goals on a national level. So, and it's also a requirement for the Illinois network. Naloxone was one of the first added services that we added when we first created the network back in 2017. And so this is just a reminder of section 19.1 of the Pharmacy Practice Act, where it states that there's that a licensed pharmacist shall dispense an opioid antagonist, and you know, utilizing the written standardized procedures. That's the statewide standing order. That's the lengthy language we used for it back then. But that Part C is a new component that came into effect back in 2023, that every time that we dispense an opioid, not just the initial encounter with a patient with an opioid, every month that they come to get their opioid prescription, we shall inform the patients that opioids are addictive, which we have to anyway, since we have to counsel them on each time they get those medications filled. And we have to offer to dispense an opioid antagonist. Now, this is in parallel. As part of our corresponding responsibility, the physicians and prescribers for the opioids are also engaging and asking, reminding the patients that opioids are addictive. And on their side, they're offering to write a prescription for naloxone. But I think we all know that that doesn't always end up with a prescription being issued. You know, there may be some cases where that is happening, but that's why we have our part of the corresponding responsibility in this situation, so that we're always engaging and asking for naloxone. And, this does not mean that you're running on naloxone every month. You could be running on naloxone every 6 months or every year. And but still, this gets you engaged in making sure that they have this. And this is for any patient, whether they are in chronic care and high doses of opioids, or they are opioid naive and they are in some of the lowest doses. The viewpoint when it comes to naloxone now is this is the same as having a first aid kit. This is the same as having a fire extinguisher in your home. Everyone deserves naloxone. And by doing this approach, we help break down the barriers of stigma that still unfortunately exists when it comes to patients who are seeking pain management. And so we can do this by helping also make sure that they understand that having naloxone, carrying naloxone, does not make them an addict. I know there's a lot of patient misinformation and misunderstanding about the use of naloxone. So again, this is reasons why we want to be able to help step up, because again, this network is to take the next step up and showing a better practice and a better approach to pharmacy. And we do that by showing an example to others and bringing others into the network. So that really leads directly into our next slide. And this is just a reminder of the additional services that we will be talking with you over these next number of months. And, and some of it's going to be reminders. A lot of you have already incorporated immunizations into your practice. But there's ways that you may be looking at opportunities where we can assist you. Same thing with medication therapy management. I know you've probably done some, lower level MTM encounters through Part D, but there's other ways that we can work with that. We just talked about naloxone. Contraception and HIV PrEP are probably our next ones that we'll be talking about next, but there's also long-acting injectables, both for on the mental health side and also now on the substance use disorder side. So you can actually add on to naloxone and take the next steps of working with your providers in your network. This isn't covered under the statewide standing order right now, but there's additional substance use disorder medications that you could be working with your providers and helping identify patients for opportunities. Of course, existing COVID-19 services, telehealth services, because that's one thing I think a lot of times we forget as pharmacists ourselves, and we think about telepharmacy, but putting that aside, looking at telehealth, us working with patients, utilizing our technology and expanding our encounters that we're having outside of the pharmacy. And this was something that, we worked and advocated for and kind of got it added in. And this was well before COVID, Starlin, 2018, 2019?
Yep.
And it was
Yes.
centered around diabetes education at that time. And we didn't realize how much more of an opportunity that this would ultimately become. And of course, the new test and treat services, and we'll be coming back. Actually, I think the next slide leads me into that discussion. I-CPEN has announced, and I will admit that we got this reminder this week about this from I-CPEN. They are having a virtual training on March 12th. Of course, and this is all being administered by I-CPEN. They're utilizing NASPA's program. And this is one of the programs that we're a licensed provider of, but since this is being offered and it's out there virtually, I highly recommend, if you have not taken the point of care testing and treat program, that you do that. If you took the old program when it was either with Michigan Pharmacists Association or even NACDS, you need to take it again. There has been a lot of advancements and improvements to this. NASPA completely revised this, working with Michael Klesper, who is one of the original authors of this program, and helped bring this up to date post-COVID, and incorporating some of the new test and treat next steps that we need to be doing as pharmacists. So again, this is a 20-hour program. This is great because, granted, this isn't a renewal year, but if you can knock out 20 of your 30 in one fail swoop, guess what? It's right here. And you can get this in. It's 16 hours of home study. So I recommend getting into this, sign up for it this week. Start working through the modules. The modules are not going to be something you can sit down the night before and go through. It's very extensive. I went through this program again about 3 years ago, and when we did our recent revision, and it's a great service set. It's going to build your confidence and help answer a lot of the questions that you may have about test to treat. It also goes through a skills assessment simply on like taking a blood pressure. Of course, we know most of you know how to do that, but also doing the lymph node exams. And most importantly, even though I know some of you have some experience with the COVID swabs, but also on how to do proper swabbing of the nasal and also back into the intranasal cavity and doing it properly. And that means, yes, you'll have to find a partner. So pick somebody you have an argument with and you want to bring some of that back with bringing it using that swab. So but always remember, it's always fair play in love and war. So just be careful with who you ask for that. But again, I highly recommend this is going to be one of those great opportunities, and again, it's being offered now. That means that we will probably push off offering it through NASPA, through IPHA, a little bit later in the year. But do pick this up now, because that can get you good and running and ready to go. Laura, I saw that your hand's up. Go ahead.
Hey, everyone. Garth, quick question. Do they send you the material to a home address to practice?
I believe they did last time that they did send us some swabs, or you may have to order them. So you we'll have to look at that. I'll have to go back and look at that, because last time I was able to, I had my own supplies, so I didn't have to worry about a kit coming to me.
Sounds good. Thanks.
No problem.
Question. I'm reading it.
As Starlin's reading that, I'll continue just giving you guys a quick Medicaid update. We're still working on pharmacies for the ability to bill. There looks like there may be a webinar coming up next month that we've been working with Illinois retail merchants and one of the contraceptive advocacy groups with the department, and they've also been engaging with the Illinois Association of Medicaid Health Plans, because we also know by getting billed and credentialed through for Medicaid is just the fee for service part of it. And just like for pharmacy side of the equation, for the prescription side, we're also going to have to credential and set up billing through the MCO. So there's been some outreach with the from HFS with their association to come together with a training webinar, and it looks like things may be ready for that versus on some communications today. So once that gets announced and formalized, we'll send that out to the network, because we really need everyone's participation in that. And that will definitely, and that's not just for contraception, not just for HIV. It's going to be for test and treat as well. So contraception, HIV, and test and treat are going to be the next stages for Medicaid billing. What I really like, because I know we asked this on the last call, I would like to see by the time we end here tonight, I'd like 5 stores to volunteer. We have to be able to show that we're bringing in people. And I know that means it's going to be rough for the first people that go through all of this. But just remember, by going through the pains of going through these processes, as we work on this together as a group, you'll be the first in the line of billing. And that's why one of the biggest benefits of this network is you get to be the first in line. And that means that we're going to be working together through some of the bumps as we go along as well. But I want our people doing this. I want the network doing this. I want us showing how pharmacy can be done. That makes it a lot easier for everyone to start bringing on board. For those of you who were around, and this is where I'm going to date myself. When 30 years ago, almost 25, 30 years ago, when we were some of the first stores doing immunizations, it was tough. But now most of you do it, you don't even think about it. And that's what we're going to be doing with this. So we got to we got to go through some of the pain right now of the slow process of getting on board, getting credentialed, going through the protocols on the medical insurance side. But it will work out for everybody in pharmacy. Illinois pharmacy wins at the end of the day on the other side. And that puts you, again, at the head of the line and the first out the door. I'm going to turn it back over to Starlin. talking about opportunities about being ahead of the line and first out the door. We have some great opportunities to talk about diabetes prevention program coaches and how we can utilize staff with not with some these are programs outside of USA, particularly with some of our grant opportunities through the association and the network.
I read through everything on that scan. It didn't really say if they provided the tools, but it did point out that if you want the Florida certification, you have to go to the NASPA Florida test and treat. So I know somebody asked about Florida before, but Florida has more live hours. This one is 20 hours of module home training and 6 hours live. Florida requires 2 more hours of live training. So anyway, why we need coaches. I know when you first started listening to me, I was asking for pharmacists to be coaches for the Diabetes Intensity Challenges. And so now we are wanting your non-pharmacists. Anybody that's working in your pharmacy that could be a lifestyle facilitator. One of our top lifestyle facilitators is on the call tonight, Lisa Good. I'm going to call her out because she's so good. Not only is she the APHA Immunization Award winner as a technician, she's one of our top DPP coaches. And we also have Healthy Heart Ambassadors. Now, DPP coaching is reimbursable. Medicaid is paying for it if we can get enrolled into Medicaid. And this training right now is part of the Department of Public Health CDC grant on improving the number of diabetes coaches, DPP coaches, and pharmacies related to those pharmacy techs, pharmacy students, or pharmacy clerks to increase the lifestyle change so that we can prevent more diabetes, prevent high blood pressure, prevent metabolic syndrome. So one of the things we learned in 10 City Challenge and in the Chicago 10 City Challenge group, where we did an excellent job of meeting all of our metrics. We got the blood pressures down, we got LDLs at goal, we got our blood sugars, everybody was doing their blood sugars, and this is before CGM. So everybody was really doing very well, taking their medication. What we could not move the needle on was movement. I mean, people would not exercise. That's a nasty word, so we say movement, but we couldn't get them to move. We couldn't get the waist circumference to come down, and we couldn't get the weight loss. And so as long as they were in our program, they stayed in the group method, and they met all their metrics. As soon as they graduated from the DSME program, they recidivated, they went back. So our theory here in Illinois is that no matter what you're doing out there, we probably need to address nutrition and movement and stress and sleeping, and do it in a group method so that everybody is doing it together, and you have buddies and pals to talk to support you through this process. And Lisa will tell you how gratifying it is to have these communications and these support groups around the participants who are going through this lifestyle change. They're friends for life. The coaches are friends with them for life. We're the first state to create an alumni group of the people who have graduated from the lifestyle program so that they can stay together. Because if you're trying, you get a lot done in a year, but it's still, you need to do more every year. And sometimes it's nice just to go on your walk and have your friends. They do this sometimes all on they FaceTime each other and do their walks. The 5 people that completed it last year, that were our best participants, they live 100 miles away from each other, and they still do this all in this virtual process. We have a platform that we utilize so that people, no matter where they are, we can talk to them and have these programs. And it's all modulated. You're taught, it's 26 modules and it's a year-long program. So the commitment is a year long. We reimburse by the number of meetings that you teach, and we cover the training, and we cover the time that you take to do the training. The Healthy Heart Ambassadors is also a coaching program, and we are working with pharmacy students who you may have helping you in your pharmacies, because pharmacies that are dispensing blood pressure meds to some of the insurance companies, if you collect blood pressure readings from them and submit them to the insurance company, you can get reimbursed for that. This is very easily done through the PQS's Equip dashboard, but we have some other organizations that are going to come forth on that. So that's why we're trying to get that blood pressure monitoring process going. It's the Healthy Heart Ambassadors is for home blood pressure. So you learn to teach someone to take their blood pressure at home, because studies show that people's routine home blood pressure taking is more accurate than when they go to the doctor's office, because of the white coat syndrome or just the anxiety of going to the doctor or trying to get there. But if they monitor their blood pressures at home, yes, Byron.
Can you do like if I can get somebody like Lisa, she's certified, can we have her remotely with my other pharmacies that don't have someone in the program, counsel patients, have them take blood pressures there and qualify?
Did you read Lisa's training book that because she's going to certify on Thursday with her Healthy Heart Ambassadors? What we're doing with the DPP program in Illinois is we're adding the blood pressure component to all of our patients that enroll into the diabetes prevention program, because they may not have full diabetes, they may be pre-diabetes, but there's probably blood pressure running along there, because most of us know that when you start getting metabolic syndrome, or your blood pressure may start rising at a certain point, and then that's the indicator, or your blood sugar rises at a certain point, and that's an indicator. So we believe those two things should be done together. We had that added to our platform so that we can pull that. And later on, after we get these, Lisa and Stacy have been so good that we have 32 new patients that are going to start as soon as we can get everybody going, and into this program. And then we'll launch the blood pressure alone on the platform, so that we can document the information and be able to share it out to the insurance companies so that people can get reimbursed for it. So yes, Byron, you read my mind. You took away my he's always ahead. I love it. We need to clone you, Byron.
Yeah. I'm getting too old to clone. There's not good.
Yeah. So Natalie, they're all training Thursday afternoon, and so they'll be ready to do that. The train the trainer for blood pressure is being kind of, she can help other pharmacies, and so can Nadia, but we can't train other people. It has to be trained by the public health department. So, but the first College of Pharmacy, we're starting with the St. Louis College of Pharmacy, and then we're SIU Edwardsville College of Pharmacy and Roosevelt School of Pharmacy. So we're going to try to have P1s and P2s and P3s pre-trained, so that when they go out on their rotations and you have pharmacy students come, they can do this for your patients that are in your pharmacies. Okay. Any other question? Time requirement is for DPP is it's a 20-hour training. they do it in 2-hour lots. And so it's either done over 2 weeks or 5 weeks. If they do it if you have longer sessions, you have shorter time. If you have shorter sessions, it's a longer period of time. For Healthy Heart Ambassadors, it's a 4 hours training. So if you have staff, also I want to thank everybody for filling out Lauren Yildes's quick survey. The more we have, the more details I have that we can explain why we have a shortage of staffing and pharmacy technicians. But if you have some super techs that would be able to do this, we generally do DPP in the evening after work, and so they hold an hour class for the first 16 weeks weekly, then it goes every other week, and then it goes monthly until the end of the program. And you're basically facilitating, you're letting other people talk, and you're pushing information out. Am I taking that? Oh, there is a point of care testing certificate at, are you saying you want it at IPHA conference this year?
That's what I'm asking Rupesh, if he is thinking of having the point of care testing certificate available. Garth is shaking his head microscopically no. We don't have time, as I'm guessing the response.
No, it's just historically when we've offered, not to get too much into operations, historically when we offer certificate training programs, people don't attend the conference if they're attached to the conference. So, and vice versa, they'll attend conference but not the certificate program. So historically it's not been proven to be advantageous for us to attach it to conference.
When we had the big grants that paid for all of them for everybody, then that's when we attached them to conference, because we made it a value added benefit for you coming to conference. But they aren't giving us those big bucks anymore.
Listen, yeah. Actually, Rupesh clarified the IDPH Healthy Heart Training Program.
Do you want to do it? Okay, so what we're going to do at conference on blood pressure is we're going to have, we're going to work, AMA has a MAP program that is teaching primary care providers the appropriate way of measuring blood pressure, because heaven forbid they have not been measuring blood pressure correctly. So we're going to work collectively with Diana, and I murder her last name, Mustafari, Dr. Mustafari. She is moved from Midwestern to the AMA and is in charge of their Million Hearts program and their cardiovascular outreach. And she is a proponent of pharmacists being part of the team-based care, providing blood pressure management. So we want to have her at the annual meeting, and then we want to have our Healthy Heart ambassadors there so that we can all brush up on our blood pressure process. And Rupesh, we will repeat the training over again to meet your schedule needs. We can repeat the Healthy Hearts faster because we're not paying for it. Public Health provides it. It just has to be on their schedule and your schedule. So we'll pick you up on the next loop. I'm good unless anybody else has any questions. If you have a technician that's interested, or a pharmacy clerk, or a pharmacy delivery person, or anybody that's a good outreach for your pharmacy, we would love to have them. Okay.
All right. Any questions? I appreciate the open discussion as we went along tonight, but this is your time for any additional questions that you may have at this stage. We do have a couple of wrap-up announcements and information, so don't go anywhere just yet. Yeah, Laura, go ahead.
Rupesh might not be able to speak. He might be driving. Rupesh, last time you said we're having some issues with naloxone NDCs. I just wanted to follow up and see if you were still having issues or if anyone else was experiencing similar issues, something that we could help triage. That's what we're here for.
Because Rupesh is a champion with
So,
naloxone.
Medicaid pays for all the NDC numbers. It's Medicare or commercial insurance that have restrictions on NDC numbers. But lately it has been available sporadically, so I bought a few extra ones, so I have it on stock. So we keep dispensing it.
Yeah,
Okay, so you're saying Medicare and commercial.
Insurance have choices on NDC numbers, which manufacturer they'll pay, but Medicaid is paying for every NDC number to the best
Okay.
of my knowledge.
Thank you for clarifying that. As someone who is still experiencing quite a lag in understanding overall clinical program opportunity, thank you for clarifying what the distinction was there.
yeah. One quick thing also on naloxone that I meant to mention earlier is that as a reminder, for Medicaid, naloxone is a zero copay opportunity for all patients. Under most commercial insurance plans in Illinois, they should also be a zero copay. Now, I can't speak to Medicare because, again, Illinois law does not apply to Medicare. But this also applies to the over-the-counter naloxone. So one of the benefits of utilizing the statewide standing order is then you are able to utilize to make a prescription for the over-the-counter naloxone so that it is covered. Because some patients are still, the price point for cash on the naloxone may be too much for some people. And you may, if you do offer over-the-counter naloxone, which I hope all of you do, you may want to put a flag note out there about, ask the pharmacy staff about how to get this covered on your insurance. So that could be some additional opportunities as well. Steve, go ahead.
Yeah, I was just going to mention, Rupesh was mentioning that all the NDCs are covered under Medicaid. And certainly Medicaid is trying to cover all the NDCs, but I should remind you that right now the queue is not turned on, so it's not denying anything to my knowledge.
Right. That's a great point. Yep. Medicaid's still working through some of the challenges from the Change Healthcare information issue from last year. Can't believe that's already been a year right now, but it still continues to be a challenge for the department. Any other questions? All right. As mentioned earlier, there are a couple different surveys. So again, we will be sending these back out to you along with the slides and the recording if you want to share this with others in the network or review for yourself. And really, as we put out the time here all together, if you could block out a real small part of your day at the beginning or at the end of the day and help us with these survey information, because the more that we have the information about your practice sites, the more that we can help direct you into where our opportunities connect. Especially with the USA survey that helps with identifying national for their programs on what Illinois pharmacies are able to do. And so we need that completed for national. The middle survey is our ongoing survey about what we can be doing to help you, what's topics you would like us to be addressing in your monthly meetings. Remember, these are your monthly meetings. And as already mentioned, the quick survey that Lauren developed last week, and to kind of help with kind of being a first step in gathering this information. So if you could take 20 minutes, quickly bang out all three of these surveys to help us help you, because the more information we have, the better we can take these next first steps with the network together. So
Garth,
go ahead, Rupesh.
the survey that Lauren created, that was less than 2.5 minutes or less. So if we can have everybody jump on that, that would be great. I know we didn't get as strong a response to start out with.
Well, I will say having over 30 responses for a first wave is good. I want to see a lot more than that, but I really appreciate those that have taken the time to put the answer the survey so far. We've only had one go through the USA survey, and we really need every member of the USA network to do that as we go forward. So, Lisa, I see that your hand's up. Go right ahead.
So I'm sorry, my son called in the midst of question period, but on the point of care testing, is that this has been my big question with that whole thing. Is that something that us certified technicians are able to take and do?
Yep. Yes, yes, yes.
Okay.
Yes, yes, yes.
Yeah, it is an opportunity for both pharmacists and technicians. So, and the Illinois Pharmacy Practice Act does allow technicians who have received the proper training to be able to assist in the administration of those tests as well. So, sorry, Starlin, go ahead.
No, my theory on why USA hasn't really jumped in and helped us with trying to land Blue Cross Blue Shield is I don't think they know anything about our pharmacies.
Right. So the more the information that they have, the better opportunity alignment that they can work with us on. Same with us. The more that we know about what each of you are able to do and have been able to do, help align us not only for projects and opportunities through the network, but also with some of the grant opportunities as well. Yeah, go ahead, Byron.
Do I need to fill out one of these surveys for each pharmacy?
Starlin, I believe,
So the CPSN needs to be per NPI.
Yeah.
Okay.
But the other ones are ours, so you can
I mean,
you can rack and
you
stack.
can, and the way I know with the quick survey for our survey, you just hit an extra space and you'll be able to put in all your NPIs and your store information all in the same survey. But the USA one, yeah, you'll have to do it each one.
Okay.
Yep. Great question. So again, our next meeting will be March 25th at 7 p.m. And we'll be sending out reminders for that again. Please encourage others that you are talking to. If you don't see people on here that you know should be on here, get them to come to the next meeting. And by then, hopefully, pardon me, we'll also have the renewed agreement for the Illinois network. And then we can get that so everyone can start processing on that as well. One of the things that I know we're going to talk about over the coming months is additional opportunities for your technicians, and considering some of them, maybe they want to take the next skill step and become a community health worker. There's going to be some opportunities from some national training programs, and the cohorts on those are going to be coming up pretty soon. And we have an opportunity to be able to help individuals cover the cost of that tuition through some of our grant opportunities. But that is a curriculum commitment. It is really taking up the next steps to bring on some serious knowledge and skills for these roles. So it is definitely a role expansion for technicians wanting to take those next steps. And we'll talk more about that at the coming meeting. Again, if you don't already have our email addresses, here are our email addresses here on the screen for you. And this will be our last time to take any last minute questions or comments from the group or anything from Starlin or Laura that I missed.
No, we don't know unless you tell us.
All right. So again, we'll be sending this all out to you, but please help us these next couple days. Put it on your to-do list to knock it out between now and Friday to knock these surveys out. And hopefully we'll see some of you at Illinois Pharmacy Legislative Day next Wednesday. And please, again, take these surveys, sign up for the NCPA training, and help us all take these great steps forward so we can make this network an example for others to emulate as we go forward in Illinois pharmacy. So thank you, everyone. Have a great evening.